Not long after that, having made their proposal to build a new earthquake-safe modern hospital and been turned down flat by the locally elected board, who wanted more control, they instigated litigation, or they went to court to ask that their lease, if it's not going to be extended, to have it terminated sooner.
Mm-hmm.
After months and months and months of unspeakably expensive litigation, the court resolved the issue that Sutter would leave sometime between July 1st of next year and July 1st of 2010. The latest date they can leave is 2010.
So that's someplace between a year and a half from now?
Yes.
More or less.
They have to give a year's notice.
Okay. All right.
Now, you may think a year's notice is a lot. However, every single functioning thing in the hospital, the medical records, the billing system, all of the equipment, has to be prepared in a year's time to move over to new management. Unfortunately, the district has operated until this last year with one half-time non-professional employee. One half-time non-professional employee does not have the capability to plan the transition of a huge community hospital which has something in the range of 1,000 employees. A huge number of employees. One of the biggest employers in the county. All of those people do not know now who will be minding the hospital,
Mm-hmm.
who will be making the decisions. This is a very worrisome thing. If you're a doctor and you're committing your career to a particular hospital, you want, above anything else, stability. You want to be treated with respect and courtesy. You want a hospital that operates with a balanced budget. And you want some focus on buying the equipment and the personnel that make high-quality health care possible. Doctors are different than people who work in other kinds of businesses because many of them commit for life to a particular setting. They have their office, they have their homes,
Mm-hmm.
they raise their families. They have been incredibly frustrated by being shut out of all the decision making. Nobody asks them what would work here, what wouldn't work here.
Mm-hmm. Mm-hmm.
But the board meetings were not designed or did not evolve in such a way that input from the professional staff was particularly welcomed. The board meetings evolved more in the direction of, if you have complaints about Sutter, come here and we will listen to you every month for as long as you want to talk,
Mm-hmm. Mm-hmm.
which is not a very satisfying situation. And if you have to be in the emergency room at 7 a.m., you do not want to come in the evening as a doctor. You don't want to come in the evening and listen to 4 or 5 hours of people complaining about your hospital. I deeply sympathize with them.
So what do you think, what are the most important things a citizen that's interested in this hospital and keeping this hospital should do?
I think more of the people who need the hospital and care about the hospital need to come to those meetings, and they need to listen, and when they understand what's going on, they need to be heard.
Mm-hmm.
They need to be part of the decision-making process. There are going to be decisions about building, there are going to be decisions about staffing, there are going to be decisions made about moving from decisions made by the elected board to a volunteer community board that is not elected by the public, but people who have real expertise in financial matters, construction,
Mm-hmm.
Architecture, and so forth.
Margaret, do you feel that people who come to these meetings will be listened to at this point from the current board?
There's been a remarkable transition since the election in 2006. The current board members, and it's a split board, 3-2, so almost nothing is ever done on a unanimous vote, but there has been a transition to courtesy, good order. The agendas are useful, and they are moving forward.
What about right now in the next couple of months? Are there some major decisions that are going to have to be made?
The County Board of Supervisors, after being totally hands-off for decades, saying, not our problem, not our problem, they finally hired a consultant to tell them what they already knew but didn't want to think about, is about a third of the patients at Marin General are what we call safety net patients, county paid through some kind of government insurance. And those people are the county's responsibility. So if Marin General Hospital does not survive as a viable hospital, the county suddenly has full responsibility for all those patients. Not only that, Marin General is the only public, non-private hospital in Marin County. It is the only hospital that provides maternity services. It is the only hospital that provides any psychiatric beds in Marin County. And it is the only trauma center in Marin County.
So it becomes the most important hospital for all the residents of the county.
It is important for everybody, whether they're Kaiser members or Novato residents or what have you, because if you're in an automobile accident on 101, the ambulance comes and you go to the trauma center because that's the best place for you to be. So every single person in Marin, and people traveling through Marin, has a stake in the survival of this hospital.
Okay. Well, Margaret, thank you so much. I think this was first of a series of reports we're going to have to follow the hospital issues there.